Hi, I am Dr. Asha Ajgaonkar and you are watching me on Sify.com.
Doctor, what are the most common complications related to the birth weight of a child?
Any full-term child who weighs less than 2.5 kg at birth is considered as a low birth weight baby. Low birth weight baby can be due to prematurity or poor intrauterine growth or both. There are various complications, but most of the complications which top the list is hypothermia, that is inability to maintain the body temperature, and infections. Babies who are oversized, that is the babies who are more than 4 kg at birth, also have various complications like birth injuries and increased incidence of congenital anomalies.
What would be your important suggestions to the parents of premature babies?
See, after discharge from the premature nursery or the nursing home, when they take the baby home, the parents have to bear in mind that the premature babies have high incidence of infections. They are more susceptible to infection. So hence meticulous attention should be paid to infection control. In that case, clean environment and mother's good personal hygiene are very important. The parent should follow the instructions given by the pediatrician or the neonatologist regarding feeding the baby, nutritional or vitamin supplementation and vaccinations. They have to take the baby to the pediatrician for regular visit to ascertain whether the baby is growing normally and doesn't have any other developmental anomalies.
What kind of precautions should be taken by parents to avoid developmental disorders in children?
Every normal parent has a curiosity to know whether a child's mental development is normal. Every child attains certain milestones, both physical and mental, during first few years of life. Parents should know whether the child is going according to these milestones. Any delay in speech development, walking, any abnormal facial features, or even any child with uncooperative or unusually bad behavior one needs to assess his intelligence. Of course, regular visits to the pediatrician, such abnormalities are picked up by the doctor.
What are the facts and misconceptions about an infant's diet?
First, we'll see the facts. The breast milk is the first food of the baby. Breast milk on its own is sufficient for the baby for first 4 to 6 weeks, for 6 months of life. After 6 months, most of the babies need additional food. The purpose of giving this additional food is to complement the breast milk so that the baby gets enough protein, energy and nutrients to grow. This is called weaning. The weaning should start by 4 to 5 months of life, not later than 6 months. The first weaning food should be in the form of homemade cereals, mashed fruits, mashed potatoes, etc. Little later, vegetable soups and soft diet in the form of sheera or overcooked rice and dal should be offered to the baby. By 1 year, a child should receive full adult diet. And regarding the misconceptions, there are various misconceptions. Some communities believe that food should not be offered to the child unless the baby starts teething. In some other communities, they have to perform some religious rituals before giving food to the baby. When you delay weaning after 1 year of age, it's very difficult to offer new food to the baby because the baby resists new food, and by the time the mother's milk also starts becoming less and less. In such cases, the baby's growth hampers.
Can we have your expert guidelines on the following? Newborn feeding.
As said, newborn feeding, the first food of the baby is the breast milk. The breast milk should be given to the baby as and when it is required. That is, a self-demand schedule is the common sense schedule. But here one should bear in mind the mother should not be allowed to feel that every time the baby cries, the baby is hungry. Because the baby may cry because of wet diapers, because of abdominal colic, or simply baby wants to be picked up by the mother. So in such cases, a rigid schedule of feeding should be taken, like a 3-hourly feeds for normal babies is good enough, so that the baby gets accustomed to this rhythm gets up accordingly and takes the feed and goes back to sleep.
Newborn sleep.
Newborn in first few days of life sleep most of the day, gets up only to take up the feed and goes back to sleep. At 3 months there are 3 to 4 sleep periods. At 1 year there are 1 to 3 sleep periods, and by 3 years the child discards the afternoon nap. Some babies, some newborns sleep during the day and keep awake till late at night. In such cases, the mother should try to change this rhythm so that the mother also gets some rest at night.
The tests or examinations to monitor the infant's growth and care.
I think the simplest test to know the infant's growth is the maintenance of height and weight charts, which are available with each and every pediatrician. There are also charts about measuring the head circumference. Child's weight, height and head circumference are plotted on a graph, and if the curve is going parallel to the normal, the parent can be reassured that the child is growing normally.
Can we have your expert views on the treatment of asthma in children?
Asthma is a chronic inflammatory condition of the lung airways resulting in episodic airflow obstruction. So hence it needs a continuous preventer medication, and I underline the word continuous, for the treatment of asthma. Here parent education is very important, because the parents have to bear in mind that the drugs used for asthma control the asthma and do not cure them. But I would like to reassure the parents that most of the children or majority of the children outgrow their symptoms. Mainstay of the treatment of asthma is medications given in inhaled forms. For small babies, there are certain devices called spacers through which these medications are inhaled. There are two types of medications. First group we called as preventer medications, and the second group is called rescue medication. A regular visit to the pediatrician is very important. After the diagnosis of asthma, in first few days at least once in 4 weeks, and later on at least once in 8 weeks. So according to the asthma control, the pediatrician can either step up the medications or step down the medications. The goals of long-term management of asthma are freedom from symptoms including nocturnal cough, freedom from emergency visits to the doctor, freedom from school absenteeism, and normal daily activities, normal participation in sports, and normal growth of the baby.